Hey, thank you everyone for joining us for our monthly multidisciplinary advocate and researchers group meeting. My name is Sharayla. For those of you who have not been here before or don't know who I am, you usually get communications from me. I'm really excited that you all are here. I'm going to stick to the agenda as I know we have quite a few things to discuss this morning. I'm so excited about a couple of them. Well, I'm excited about all of them, but some bring me a little bit more joy than others, if I'm being honest. Not that you ask, but I'm going to tell you anyway. Okay. First, I just want to ask if there are any new attendees who would like to introduce themselves. There is no pressure to do so, but if you would like to introduce yourself and what area you work in or what your interests are, that would be great.
I'm a new attendee for today. My name is Lenora Enlow. I'm the Community Health Facilitator Manager for Facts Not Fear ICT, and I work in Department of Population Health with Dr. Ablah.
You're welcome, Lenora. We're so glad you could join us today. I've heard so many great things about you. I'm excited to see your presentation today.
Thank you.
Hi there, I'm Sage Brown. I'm the new Director of Operations in the Pediatrics Department under Dr. Evelyn Nelson. So thank you for having me.
Awesome, welcome Sage. I really like having new people on so they can give us a perspective on things that maybe they'd like to see in this meeting or ideas that maybe we're missing, people that you think should be invited, things like that. So as those come to you, feel free to share them with me. Our group is not easily offended. So if it's like, hey, this was whack, you can say that and we'll be okay with that. Just help us figure out how to make it not whack. Okay. So I would just like to say that every single time that we meet, I'm going to implore you all to become a member of Frontiers. So as you can see from my header here, I work at Frontiers, our Clinical Translational and Science Institute, and membership has many wonderful things, one of which would be to receive our monthly and now bi-weekly newsletter, which is chock full of not only information about research, but also community events and things that are going on regionally, statewide, citywide, all those things, macro all the way to micro. So there's lots of things that are in that newsletter, as well as if you ever need to have a consultation with one of us that work at Frontiers, we would like for you to be a member so we can track it. Because when we report to the NIH, they need to know what we're doing, that we're not just, you know, sitting in our cubicles, twiddling our thumbs. Okay, so you can click the link that's right there in the invitation to become a member. It is very easy, very straightforward. And if you are in the clicking mood, go ahead and follow us on all of our social media. We're on Twitter, Facebook, LinkedIn, and YouTube. I actually just uploaded last month's MARG meeting to our YouTube page, and you can find a lot of really interesting things there as well. So feel free to do that. And I'm going to turn it over to Alan to talk about item C, which is our Broderick Crawford Community Partnership Award, because it's something I'm really excited about, and it's been his brainchild actually. So Alan, let's talk about it.
I don't know if it's been my brainchild. Thank you, sure. I think it's been a group effort. I'm sure some people on this call knew Broderick Crawford. He was a real inspirational community leader here in the Kansas City region, heavily involved in partnering with researchers out of the NBC Community Development Corporation that he headed in Kansas City, Kansas. Very involved in COVID work in our region with others of us that were doing public health work through the pandemic, but also really involved in scholarly research that combined community participation and those of us on the academic side. Unfortunately, Broderick passed away unexpectedly last year, which was hard for a lot of us, but we had already actually planned to have a mini grants as part of our community engagement program in Frontiers. And so we've now named as the Broderick Crawford Partnership Awards, and they are now available for people to apply for, either folks on the academic side who are already working with community partners or want to establish new partnerships with community entities, or community-sided individuals or patients out there who want to do more with researchers. The awards are, correct me if I'm wrong, Sharayla, but I think we've landed on 1,250 to $2,500.
$2,500. Yeah.
And we will probably be able to award 10 or even maybe double that, depending on what we see in interest. And we'd like to just get them out the door. So Sharayla posted the link to the application. It's a very brief application. We don't want it to be onerous. We want it to be simple. So if somebody, say a community partner or a community entity, wanted to apply, we want them to be able to do so quickly and know something fairly quickly. So we'll be trying hard to turn the responses around quick. And really the goal is to help people spend this money on good work. That you'll see the application spells that all out, and promote more and more collaboration between researchers, research teams, and community individuals and groups. So I will stop there. We could do quick questions, but we can also take follow-up if people want to contact us afterwards, so that we have plenty of time for our presentation today. But if there's any burning questions, please shout them out or throw them in the chat.
Thank you, Dr. Greiner. And I'm always available via email or Teams. If you want to send me a message, if you have a question or you can't find the link again or whatever, just let me know. I will be sending out a survey by the end of this week, well, early next week, just to ask about how you feel about this group, this meeting. What do you want to get from this group? Does this time still work? And just, I'm going to leave a box also for any other comments of things that you might want to see from this group and things that you would like, that you think are missing from Frontiers also with this group. And so that will go out. Please share it with anyone who you don't see in our meeting that you know has been invited, that maybe they miss it, like, hey, fill the survey out. It should be less than 11 questions. I want to keep it as short as possible. I know your time is valuable. So be on the lookout for that survey next week. And also the MARG meetings will be canceled for July and August due to summer vacations and all the exciting things that people have going on. It just makes it easier to just take it off your calendar, and we will resume in September. I think that is all the updates that we have. Dr. McGee, I know that sometimes you have to leave early, and I want to make sure that we have enough time for you to make any announcement about tomorrow's event. Did you want to do that while I have you on the line?
Sure, I can do that real quickly. Thank you, Sharayla. Sharayla, I'm going to.
You have a lot going on. It's a lot.
It is with a lot going on, but Dr. Falakov will tell you that I have mispronounced her name for how many years now? Your first name?
You know what? It's Tamara, and you know that, Geraldine. You're fine.
Yes, thank you, Sharayla. Tomorrow we have a pretty big day. It is the Juneteenth celebration, and while we are celebrating Juneteenth, we also want to celebrate the launching of the Center for African American Health. We're launching phase 1, July 1st. And we are really excited about that. It has been a long time coming. We took about 2 years to plan, but we were very strategic and thoughtful in our planning. So really excited about that. Some of the CAHIT, which is the Center for African American Health implementation team, are on here. The task force is on here. We have associate directors on here like Dr. Charlotte Smith, Dr. Elizabeth Ablah was a part of the planning team, and we are just excited. Now, tomorrow, if you do want to come and you have not registered yet, because we need an account for food, we welcome everybody to attend. But if you're not registered, we will not be able to give you a meal ticket because we have reached our capacity for food that we have planned for. So this is a really good problem to have. It's a really good problem to have. So it is, and Sharayla will be performing tomorrow. I need to point that out, and we are so excited about that. But it is a jazz festival. So there won't be a lot of talking. There will be a lot of music playing. There will be a lot of fun. There will be a lot of food if you have your meal ticket. And it's just going to be a good time. So we welcome you. Representative Sharice Davids will be there. And we'll be making a few comments, and many of our leadership team will be there. So we welcome you. Please come and enjoy the time with us and the good music that we have. We have like 3 performers, and we have a DJ, and we're just excited. So thank you so much for giving me the floor to make that announcement.
Thank you. So excited to see this phase 1 of what's going to happen, and I'm glad to be a part of the celebration. And this is historical, so I'm just amazed to have been a part of something that is going to be a legacy, like that continues on and on and on. So congratulations, thank you. And from the chat, I am going to announce also, so the Broderick Crawford Community Partnership Award will be, like, this is our first bigger group that we've told about the award, to be honest. But the next phase of that will be at the NBC CDC's 101 5K Run, Walk, and Block Party, which will be next Saturday. Most of the people there knew Broderick in some way. And so we're really, really excited to have his family there and colleagues and friends so that we can make this announcement to that group as well and extend these monies to community organizations that can really use it. And that is exactly what Frontiers is designed to do, to bring these 2 groups together. So, okay, I know it's time for our presentation. I don't want to talk too much longer. So I'm going to turn it over to, where are you, Dr. Ablah? Oh, there you are.
I'm right next to you on my screen.
Me too. So why couldn't I find you? Dr. Ablah and Lenora Enlow are going to present right now. So thank you so much.
Thank you all very much. I know Lenora introduced herself this morning at the beginning of the meeting. So I won't do any introductions, but I will say I'm so touched that you have this award in Broderick Crawford's name, and I think that he would be really pleased to see that this is happening. It really suits him well. So thank you for that. And it is really a pleasure to be on here this morning, not only with so many friends and colleagues, but also to introduce Facts Not Fear ICT to folks we don't know. So we're really pleased to be on here and eager to have a conversation that is going to be, I hope, useful. So I am going to turn this over to Ms. Enlow, and we will get this party started.
All right, well, thank you. Thank you everyone for having us, as Dr. Ablah mentioned. I'll introduce myself again. I'm Lenora Enlow. I'm the Community Health Facilitator Manager for Facts Not Fear ICT. Our initiative is about lessening the impact of COVID-19 on some particular disparate populations. And so we are going to talk about that today. So we're going to discuss a little bit about the background and purpose. We're going to talk about the populations that we serve. I'm going to give you guys a few examples about the work that Facts Not Fear ICT does. Feel free to, chime in, or if you have questions. I want this to be interactive. I think that's okay. And we're going to discuss how we are a community-based initiative and how this is, key to everything that we do. So background and purpose. Our official title of the initiative is Advancing Health Literacy to Enhance Equitable Community Responses to COVID-19. This is a 3-year project. Our whole goal is really improving health outcomes in Wichita's communities. We believe that through health literacy, we will be able to create the most impact. And we do focus on other mitigation practices for the underserved populations as well. This is administered through the U.S. Department of Health and Human Services, particularly the Office of Minority Health, and it is based at the University of Kansas School of Medicine. And we do have several partners that help us. We could not do it by ourselves. We have about 32 partners and counting that have helped in some capacity over the last couple of years. And so we love our partners. We're excited about that. The purpose of our project, as we discussed, is lessening the impact of COVID-19 on disparate populations. We are doing this by, one, improving health literacy amongst the disparate populations. Again, we believe this is key to being able to break open everything that we are after in this project. Two, we focus on including these key populations in the development, the implementation, and the evaluation of the project. And so we have different ways that we do that, and we're going to discuss how we our approach to engagement. Three, we focus on improving provider-patient communication, which is really the crux, I would say, of what we're after. We do believe that by helping to build trust and really provide trusted resources to the community, that we can see a growth, an upscale on improving health outcomes. And four, we focus on increasing access to testing and vaccination resources. Now, this was our original focus back in 2021. It was, coming off of the height of the pandemic when we received the grant. And so, Goal 4 was a key focus of ours. And so we started out by focusing on the direct impacts of COVID-19. We have now shifted our focus to more of the indirect impacts of COVID-19, such as substance abuse, domestic violence, and other things that have become exacerbated due to the pandemic. So health literacy. We focus on improving health literacy amongst disparate populations. Research shows that low health literacy is a significant predictor of poor health outcomes. Research also shows that there is a stronger association between health status and health literacy than between health status and many other demographic variables. So we are key proponents in, removing barriers to health, and increasing access. But we do also understand that by focusing on health literacy, we can really improve health outcomes. And so, we connect with other resources to help provide, some of the additional proponents, for the social determinants of health, but we are really focused on health literacy. Low health literacy is significantly more prevalent in socially disadvantaged communities, as I mentioned. Us partnering with other resources that are able to provide assistance really helps us to engage as well, and helps the overall community. And we see this in communities that have low educational attainment, low income, low English proficiency, etc. Now we're going to talk about disparate populations, so I will turn it over to Dr. Ablah.
Thank you. So a little sort of back up as to why are we talking about these populations and why do we call them disparate populations? So a lot of our verbiage is from HHS directly, the Office of Minority Health. And so we are using disparate populations as the verbiage because that is the verbiage that they have been using. These are also the 4 groups in the way that HHS classifies these groups. The folks that we identified for this project, as you can see, are these 4 populations. They are the folks who do tend to have the highest risk for health disparities and low health literacy in Wichita, which is our area, our focus area. But we also specifically are only working with adults. And again, that is guidance from HHS. So adults in Wichita who are Black or African American, Hispanic or Latino, Asian, American Indian, and Alaska Native. If you'd go to the next slide. So a little bit of background as to why these 4 populations and how do we even know that these are the populations who were disproportionately impacted by COVID. So first of all, local data demonstrate that. So if you go to the next, we'll start with the testing rate per 100,000. So folks often know about rates that when you do anything per 1,000, 10,000, 100,000, it gives us a way to compare apples to apples rather than apples to refrigerators of saying X number or X percent, right? So if we're looking at the testing rate, this was in Wichita, and I should say that this was in, oh gosh, hold on, 2022. From July 2022 to September 2022, you'll see the testing rate. So we are not seeing Asian American, Asian at all, American Indian, Alaska Native, Hispanic, Latino, but we really had something going with Black African American populations. A lot of this I attribute to the previous Facts Not Fear, not our Facts Not Fear, it was Facts Not Fear. It was the original campaign that was launched specifically to address COVID, specifically among Black and African American populations in Wichita. So that is a huge win, in my opinion. If you wouldn't mind going to the next. Thank you. So let's look at positive cases. So when we are seeing, again, the same population, same order, you can see, well, with the American Indian Alaska Native, we had very few of the testing who were testing. So really no positive cases, and obviously a lot more positive cases when you have a whole bunch of people who are testing, right, for Black African American. Definitely disproportionate in terms of Asian. So really, really large in Hispanic Latino, considering that really the testing did not occur at any substantial level. So disproportionately impacted in terms of positive cases, if you don't mind. Okay, so how many were fully vaccinated? Again, that American Indian Alaska Native population, truly, really problematic here. So we have a lot of work that we have done in our community, but a lot still needed to be done. So, I should say, you know, we presented data before the grant was received that was very clear in demonstrating that we do not have sufficient testing, and the testing was much worse, that the positive cases were much more disparate, and then fully vaccinated was just beginning. If you don't mind, go to the next slide. Okay, so that was local data. Now let's look at national data. So this kind of really preceded our local data because we knew that there were disproportionate impacts. So if you're looking at a slightly different order, but the same groups, you can see the cases are much greater in the especially Hispanic or Latino and American Indian or Alaska Native. Hospitalization, much 3.5 times more likely to be hospitalized if American Indian or Alaska Native, 2.8 times more likely Black and African American or Hispanic. And then in terms of death, again, huge disproportionate for American Indian or Alaska Native and Hispanic or Latino persons, and Black or African American was 2 times. So this gives you a little bit of background that we have we had national data very clearly demonstrating that this is a problem. We had local data demonstrating that we still had inequities. And if you wouldn't mind going to the next slide, you'll see the population in Wichita. So we in Wichita have 3 of the 10 zip codes with the lowest average adjusted gross income. And our 67214, which is where we are in KU, you can see the proportion of our residents and what racial and ethnic group they belong to, and then also the insurance. So you can see here a lot of stats, a lot of numbers, but this is also, unfortunately, very well publicized, well known, that we have the worst birth the mortality rate for, and Dr. Smith is on here, I believe, she was at least in the beginning, in addressing this infant mortality, and one of the worst in the country. So we have a lot of work to do, and this is a population that we is the 67214 in particular, we're really excited about partnering with, because it is our area. So if you wouldn't mind, Ms. Enlow, we have, sorry, no, one more, sorry. Okay, so we have, just to give you a better sense of Wichita altogether. So looking at our population, Hispanic or Latino, about 17% of our population, Black or African American, 10, Asian, 5%, and American Indian or Alaska Native, 1% of the city's population. So we have community health workers, we call them community health facilitators, that we've hired to address each. So we have 4 community health workers. So we're very excited to be able to address these populations in ways that are culturally appropriate, and also we have folks who are trusted partners in these communities to be able to deliver messages that are important. All right, now, if you wouldn't mind, Ms. Enlow, let's talk about some of the activities that we're doing.
Okay. So moving on to some activities. I wanted to start with our community engagement approach. I do believe that this will help us kind of walk through some of the activities and how they all align with the project, and how we are working to attack our goals. So we are Facts Not Fear ICT, and we engage the Wichita community for the sake of increasing health literacy, improving health access, and ultimately improving health outcomes. How we do this is by, first and foremost, we seek to understand. As we mentioned earlier, goal 2 of our initiative was to really be a community-informed initiative. We want to include the populations that we are working to serve in the development, the implementation, and the evaluation of the work. And so this, to me, is almost, it's a principle. And when we talk to our community health facilitators, this is what they're doing at the patient level. And to keep the integrity of this, right, this is what we should be doing at the macro level from a Facts Not Fear ICT perspective. So as we seek to understand, we do that in a myriad of ways. We have community influencer interviews where we have had our community health facilitators, advisory board members, and other key individuals within our project identify people who could be seen as influencers, not necessarily on social media, but really just, community leaders, and finding out, what are their concerns? What do they, how do they feel about the medical industry? What are their thoughts about substance abuse? What's going on in the community? We have patient and client assessments, again, working to keep the integrity of, is our project working? Are we really helping to improve patient-provider communication? Are these things being done? And then there's our advisory board as well. And we are always, as I mentioned, just seeking to understand. The second thing we do is we focus on educating the community on health. Our intervention of choice, we have something called community health sessions, and they're 45 to an hour-long minute sessions that we have that really focus on empowering individuals to take back their health. We focus on key behaviors and, I don't want to say simple knowledge, that's not the right way to describe it, but things that everyone can embody. Some things I'm sure people know, but there are a lot of things that we've presented that we've gotten feedback on that individuals did not know or participants didn't know prior to receiving the information. And so we focus on a few topics: stress and mental health, healthy behaviors, health visits and screenings, which really talks about doctor visits, why to go to the doctor, what the cost is going to look like, when to go to an emergency care room versus immediate care versus emergency room, and those kinds of things, and just giving them what they can expect. We talk about COVID-19 and prevention, And on the horizon, we're going to start doing some discussions on domestic violence and substance abuse. These sessions are very interactive, and so far they have been incredibly successful, and we are seeing individuals start to make small changes. And that's really the goal, starting with small changes and hoping to see that grow. The third thing we do is we connect the community to resources. Our community health facilitators also do community health work. As she mentioned, they're community health workers. And so they focus on care management, identifying needs, connecting the community to resources and addressing barriers to access healthcare services. And so that's where our partners come in. We have several partners that really help us to provide a conglomerate of services, if you will. And we're very focused within the clinics and working on that clinic and community organization support. We believe that syncing up communication between the clinics, the community organizations, and what our community health facilitators are putting out really helps to streamline the flow of communication. And as we start connecting with these community organizations, if we are all preaching the same gospel, then people are more apt to adopt it. And so, our partners have been everything with helping us to connect individuals to resources and connect the community to resources. So this is our community engagement approach. Now we're going to talk a little bit more about our particular health literacy intervention, or how we intervene with health literacy. So we focus on educating the community on health. As I mentioned before, these are interactive sessions designed to improve health literacy amongst these populations. Our focus is to increase access to trusted sources of information, simplify decision-making about health, and improve overall health. And we talked about some of the health session topics that we discuss. Some of the things that I love about our interactions within our community health sessions is, really the simplification of decision making, being able to do this from a health literacy perspective and break it down to where people can use normal associations to understand sometimes concepts that shouldn't be hard. But we're not doing it in clinic speak. We're making it culturally and linguistically appropriate so that the information really gets, it really becomes embodied, in the person's mentality and hopefully in their actions. That's our whole goal. We do have a call to action at the end of every session where we are encouraging participants to even share, what they plan to do upon leaving the session, in hopes of really helping them to think through, okay, when I get out of here, these are steps, these are simple steps that I can take to start improving my health. Clinic and patient engagement. As our third goal, I think we discussed, was to improve provider-patient communication. We focus within the clinics on quality improvement, and specific to healthcare providers. And so we provide health literacy training, assess organizational multicultural competence. I know that we perform trainings on the teach back method, and I think there's some other methods that we're doing that as well. We facilitate patient empowerment to increase patient self-efficacy, which is key in motivational interviewing, and we assess patient experiences, which is really us seeking to understand, is what we're doing working? Yes, can you?
I'm so
share?
sorry. I didn't
Okay, go
mean to
ahead.
interrupt you in the middle
No,
of
go
the
ahead.
sentence. That's why I raised my
That's fine.
I just want to underscore what she's saying here. A lot of times we do these interventions where we are just working with the community and that's it. And we're hoping for individual level change. And I don't think we have a lot of promise often with that. When the problem is systemic, we have to address the system, right? So we're really excited about this component of the work that we are really truly looking at health literacy for the providers. And it's not just for the individual providers, but it's for the system. So thinking about how we provide health literate information that they are providing, for instance, to patients. How can we help these individual clinics, the federally qualified health centers, to be able to measure their organization's competence? And so it's really exciting to see we're not only addressing individuals within that system, the healthcare providers, and not only clinicians, but also the folks who help facilitate the process of the working of the clinics. So I wanted to say how exciting that part is for us, that it really is not just about, here, we're going to give you tools and good luck with all the stress that's out there, because we know there's a lot, right? We want to make sure that we are preparing the organizations who are helping to serve the populations that we're serving to be able to do this in an adequate manner. So sorry to interrupt. I'm not going to raise my hand again.
No, I thought that was great. I appreciate that. And it brings back emphasis and, helps us to really understand, are we achieving our goals? And to broaden, like you said, the spectrum of how we are doing this. And that's massive. This is massive. So thank you for sharing that. And improving health access. When we are improving health access, our goal is really to establish partnerships with local organizations and clinics. Sedgwick County Health Department, Kansas Department of Health and Environment, Hunter Health, and Health Core Clinic are some of the larger names. So it was easier to add those to the slide, but we do have over 32 partners at this point, and are working in so many ways to find the synergies. Where do our goals align, and how can we best connect and serve? And to Dr. Ablah's point, how do we serve the clinics? How can we serve? We have lots of stakeholders in this. And so really being able to understand everyone's point of view is really what's going to help to bring all of this together. We also focus on developing strong public health campaigns and establishing credibility within the populations that we serve. Again, with the partners, we found that word of mouth via partners and supporters has been by far the way that people find us. And so, being able to have that trusted experience with Facts Not Fear ICT allows us to open up avenues for our partners and vice versa. And so word of mouth has been the biggest way, one of our most successful outlets, followed by that closely is social media and also radio. We have done some billboards, we have done, a commercial or two, but word of mouth by far is our most successful outlet. And I would prefer it that way. And I think that establishing these partnerships is really what's helped us to do that. We've been able to, we're not say a newer project, but we came out and no one knew about Facts Not Fear ICT, but they did know Health Core Clinic, they do know Hunter Health. And so being able to get some street cred, if you will, from our partners, it's really helped to make our project successful. So we're going to talk about how this is a community-based initiative. So again, our goal of including these disparate populations into the development, implementation, and evaluation of the work, we need community input to do that. We have our community health facilitators, which are golden. They are everywhere. They are, at different community events. They belong to different coalitions and organizations that help to, help us keep our ear to the ground. They are in the clinics. They're working with the patients. They are everywhere. And I really do believe that they are a strong key to creating this macro feedback loop for us to really understand how is all of this working and how can we sync it up. We have our advisory board, which we found that with our advisory board, it's important to create community there as well. And so, we have several members who are fairly available to us, and are willing to pick up the phone if we have questions or concerns about being able to engage different communities, and help us to remove some of those barriers for Facts Not Fear ICT. We have interviews with key influencers, just regular talking, with community members and taking what they're saying to heart, and community organizations as well. Again, I really think that these community organizations are key because they're already invested, and they see people, they know them by name, and are able to get out the information and help us preach the same gospel. Our biggest strategy, that we really talked about, I can't say our biggest strategy because there's a lot of embedded strategies, but when it comes to engaging the community, a lot of the stuff sounds cliche, but it works very well. And I think that it's key to just human value. We focus on listening, as we mentioned before, seeking to understand, with interviews and partner agencies, but really listening. I tell our community health facilitators a lot that our goal is really to create value. And value is tough because value is subjective. So when you have lots of stakeholders, there's the political factions, there's, the city of Wichita, there's KU Med Center, there's, all of the clinics that we interface. There are the people who are on the ground level doing the work. There's various community members and then the different communities that exist. And so there's a lot of listening that has to take place for us to understand what is value to you, who is in front of me, and how are they thinking about what their needs are. Communicating, we communicate through our community health sessions, flyers and promotion media, identifying partners, with similar interests. And I really think that again is key, is finding those synergies where you can start making inroads and small changes and building trust. We really focus on building trust, and I'll give you guys just a few examples of what that looks like for us. Recently, I had met with a member from our advisory board. We've been working to try to create, to get more involved with our Native American community in Wichita. And we've, been struggling a little bit there. And so we had an excellent meeting where he had said some things that I really took to heart. And he said, our community gives just for the sake of giving. He said, we're not giving to get something. And he said, it's hard for us when an organization comes in and they want to give us something that A, we don't want or didn't ask for, and B, they want to give us something and then get something in return. And, that really stuck with me. And I thought about that and I said, let's think about how people really work at their core, at their base. And we do need to be able to build trust. And it's hard to do that without being able to just actually give, or respond in some manner to what people are saying that they need. And so he said, well, I need you to show up at this Native Coalition meeting. I want you to speak and, basically tell them the same thing you told me. So we show up, we're at the meeting. We start out and it's pulling teeth. Nobody's responding. I'm new. They don't know who I am. They know who Facts Not Fair ICT is, but, we're really reluctant, I think, to share. And, he spoke up because he's become a believer. I think he knows we have a heart to really help, and was like, hey, they want to help you guys, they want to help us, what is it that we need? And, they had asked for a food distribution. And, we were like, okay, this is a lift. I'm not really sure how this aligns. I'm not really sure what we can, do. I mean, it aligns with, social determinants of health and improving access to health. But, don't know if I can get something like this approved. We're having these conversations and I'm there on the spot. And I said, I don't have a magic wand. I said, but I've got some project coordination skills and I have some elbow grease. Let's go to the table and let's see what we can do. And so after a couple of meetings, we found out that really they had everything they needed. They already had a gentleman, a contact from the Department of Children and Families who also works with the Kansas Food Bank. And he was able to they only wanted 100 boxes of food for the food distribution. And so he was able to get 100 food boxes, for at least a one-time distribution. We're still talking about how we can make this a long-term, thing in their community, but this is what they asked for. And so, being able to get that vote of trust, he said, "Hey, Lenora, I need you to show up." And so we're showing up. He said, "Hey, Lenora, this is what we're asking for. We want a food distribution." And, this is out of luck, or we just got blessed in this situation. But again, they already had everything that they really needed. They just needed a facilitator. And so us going in and, bringing folks to the table, now they're starting to trust me, and me being, a direct contact with them, I can show them, hey, we have a larger group. We are Facts Not Fear ICT. You can trust us. And so being able to build that trust, by really responding to what the community identifies as their need, I think is key in being able to, create the access that's needed for us to be able to get involved. And we have other objectives that we're working on that are more so aligned within our plans. But I think that being able to start there mattered. It definitely mattered to them. And we're seeing the fruit of that now. So that's just one simple example. Another example, I think, with our advisory board, we've had individuals talk about particular goals that they're working on, or things that are plaguing them. We have a gentleman who works at a hospital who is struggling to build trust within the Hispanic community, with regard to filling out different informational type surveys and things. Excuse me. And he has asked for support there. And so, we don't know what we don't know, and we don't know until we have the conversation to understand, is this something we can do? Is this possible? But really, truly building that trust and just saying, hey, we're here with you. We're a partner, and we're here to serve. And I think that goes a long way. And building community. And this goes, I think, just people to people. We have to build community everywhere. Like I said, we had to build community even within our own advisory board for us to, to get as far as we've gotten. And so I believe that that's done by creating shared values and creating a common goal. And so, when we can give first and, help the community with what they're saying they want help with, not just what we think they want help with, but what they're saying they want help with, even in small ways, that's seen, and then they will reciprocate. And so that is all that I have. Dr. Ablah, did you want to add anything?
You stinking nailed it. You did a beautiful job. I'd love to open it up to questions and thoughts. You did a tremendous job. Thank you.
Thank you.
So first of all, Alan and I are chatting on the side about how we can come visit you in Wichita and just watch this happen. So I just want to put that out there. We're inviting ourselves.
You are welcome. You did not invite yourselves. I put it out into the energy of the atmosphere. I'm hoping you felt it. So I'm glad you did.
Yes, this is incredible work that you are doing. I have a lot of questions. Some of them I will just ask you offline, Lenora, if that's okay, because I have like a sheet full of questions. You can't see it because of my background. But two questions I wanted to ask you. Are your health sessions in person, or are they hybrid, like virtual?
They are in person only. We've never thought about doing hybrid sessions, but yes, right now they're in person.
Okay. And I was curious as to, and I know you probably have a whole strategy around this, which if it's too much, then we can talk about it. Because again, I'm like in your life now. So just prepare for me to be there. How, how do you increase the access to trusted sources? I know that was one of the things that you said is key, but how do you actually, like, what are the steps that you have taken to do that?
So first, we have really worked to get to know the community resources that exist. And a lot of, again, kind of seeking to understand what is out there, what are people saying is actually helpful. We have gone and, gone to some of the resource fairs and, called and met. We do a lot of networking. And so we meet with these different organizations to see what they offer. But there's complaints in the community too about different organizations. And so we take that seriously as well. But that's where we start, is really gathering information. The next thing that we do is, as we start to do our community health sessions, we actually invite our partners to come and speak. And so if we are talking about mental health, we may have a therapist that comes. There's one in particular who there's no need for insurance, or at least they can give like 6 free sessions, for individuals who have a mental health crisis. We have individuals who talk particularly on violence. There's, right now we're looking for substance abuse, organizations to help and be able to connect them to resources. And so we do have pamphlets and things like that that we provide. But now that our community health facilitators also take information from individuals, and if they're needing help accessing these organizations, our goal is to know these folks by name. So a lot of our community health facilitators, they've been instructed to do is, I've mentioned, hey, go find, key organizations and really get to know these people. It's so much easier instead of handing someone a pamphlet and, allowing them to just walk out the door. They don't know what the process is. Maybe they don't have a computer to fill out the application online, or whatever the situation is. We need to know these people by name and be able to pick up the phone and say, hey, Susie, I'm sending, Mrs. So-and-so over to you, or to send an email of names and be in the community. That's, I think that's the strategy, is to be in the community. What are the organizations that are doing the work? Who can we connect with, who they're really truly aligned in how we think and organize ourselves? How do we get as close to the people who are able to remove the barriers? And we do, like I said, invite those individuals to our community health sessions, to hand out their cards, talk about their program, but just really trying to stay connected and working even with our community organizations to help them understand who can help as well if they're seeing a problem, on scale. If they're like, hey, we keep having all these people come in and they're struggling with diabetes, or this is an issue, connecting in that way. I hope that's helpful. Did I answer your question?
Yes, thank you.
I just have a quick question. First of all, thank you so much. This is great. I also have a lot of questions, but I'm just curious about your funding mechanism, and also how long you've been around. How long do you foresee you all being around? I think that's part of the dynamic too with communities. Thanks.
So we are funded, as they mentioned before, it's through Health and Human Services, particularly the Office of Minority Health. The City of Wichita is the fiscal agent. And so everything that we do has to be approved by them. And that's kind of what I meant with value being subjective. Is there are times, where we're going back and forth and saying, hey, this is what we want to do. And it's, no, this is not happening. Or we have to find other ways to, to achieve our goal. So yes, the City of Wichita is the fiscal agent. And we do what we can to try to get our plans submitted and approved well in advance, so there's no surprises.
So this is an ongoing grant that you renew, or is it a permanent? Like, I'm just curious about the sustainability, basically.
Oh, I see. So no, this was originally a 2-year grant. We did get a no-cost extension recently. So we are around until June of 2024. We do have plans for sustainability, and we are still what's the word? I think compiling what that looks like. I know that we plan to have a website that's going to live on with a lot of the materials. But my goal is really to embody these networks, this idea of, getting these community organizations that are seeing people that are doing the work in various ways, but helping them to really preach the same gospel and to know what the clinics offer, to really know and understand these folks so that the feedback loop doesn't go away. Because I think that as our community health facilitators engage with the patients, the community organizations, and the clinics, they are constantly connecting all of these groups together to say, hey, here's some support for you. There really is a lot of support, but it's a matter of knowing who, when, and where. And I think when we can connect faces and names, and we do that a lot through events, and just kind of embodying this idea of really improving health outcomes in Wichita.
I think one other thing that we're looking at is, well, we're trying to identify opportunities as we are currently embedding the community health facilitators into the FQHCs, the federally qualified health centers, and obviously they're integrated into the community, how they might be picked up at the FQHCs. A lot of them are demonstrating value already, and we want to make sure that we're able to build the careers of the federally qualified health centers, of the work that they are doing around community health workers, and obviously build the careers of the community health workers as well. We are looking at additional opportunities to be able to extend this type of work, including keeping on people who are phenomenal, like Lenora Enlow. That's really important, that when you find people who have shared goals and are really creative and thoughtful about the way we engage in communities and the way we partner, it's want to hold on to that as long as possible.
You.
I know we're probably at time, but I'm going to put my contact information in. Lenora, if you wouldn't mind doing the same in the chat, we can go ahead and I'm happy to answer any questions at any point and connect with folks. Really appreciate the energy that you all have, and we're really excited about being able to present to MARG. Thank you all so much.
Yes, thank you.
Thank you both. This was a great way to start our summer break from the MARG meetings. It gave us a lot to think about. I should only speak for myself. It gave me a lot to think about as we navigate through this world of community engagement and community and collaboration. So thank you both. We are at time. If there are any quick announcements that I missed, feel free to make them now. I'll wait about 15 to 20 seconds. Yes.
I can go really quick. So next week we have an event in KC. The All of Us Journey Bus is going to be at Mercado Fresco. It's a local grocery store in Argentine, Kansas. It's going to be there from Tuesday to Friday, 10 to 4. And then Thursday and Friday, we also have a health fair / fun event around the bus with several community partners bringing different clinical services, but also dance and food and stuff. So if you're more than invited, if you want to come become one of the 1 million participants in this national effort. Thank you. And maybe Sherelle, I can send you the flyer to share with the group.
Absolutely.
Thank you. We did that last year in Wichita, by the way, and it was amazing. Time to go back. Thank you all. That was.
Right. Thank you so much. As a reminder, you will receive a survey. Please fill it out next week. Let us know what your preferences are, and we will not meet in July or August. Enjoy your summer. We appreciate all the work that you do in the community, and we'll see you in September. Well, Wichita, we'll see you before that, Lenora.
That's what I was thinking.
Thanks,
All are welcome in
everybody.
Wichita.
Thank you so much. Bye,
Thank
everybody.
you.
Bye.
Bye. Have a great
Bye.
summer. Bye-bye.